Why does mixed hearing loss fluctuate, and how do you cope? Imagine your hearing changing from day to day or even hour to hour. That's often what happens with mixed hearing loss, which involves both the outer or middle ear and the inner ear or auditory nerve. It can be confusing and frustrating, but understanding why it fluctuates can help you manage it better. Mixed hearing loss happens because the causes affecting the outer or middle ear and the inner ear can change over time. When these issues vary, your hearing levels can also change. For example, if you have an ear infection, it can cause swelling or fluid buildup in the middle ear, which temporarily blocks sound. When the infection clears up, hearing may improve. But if the infection returns or worsens, hearing can decline again. On the inner ear side, conditions like Ménière's disease cause episodes of fluctuating hearing loss. This disease involves abnormal fluid regulation in the inner ear, leading to sudden or gradual changes in hearing, often with vertigo and ringing in the ears. Autoimmune inner ear disease can also cause hearing to worsen and improve in cycles, as the immune system attacks and then temporarily stops affecting the inner ear. Noise exposure or damage to the cochlea can add to these fluctuations, especially if the damage worsens over time. Because mixed hearing loss involves both parts, fluctuations can happen when either the outer or middle ear or the inner ear is affected. For example, a middle ear infection might temporarily worsen conductive hearing loss, while an autoimmune flare could impact the sensory neural part. Sometimes both happen at once, making hearing levels unpredictable. To cope with these changes, regular checkups with an audiologist or ear specialist are key. They can monitor your hearing and identify treatable causes like infections or wax buildup. If an infection is present, proper treatment with antibiotics or ear care can help reduce fluctuations. For autoimmune issues, medications like corticosteroids might be recommended under medical supervision. Protecting your ears from loud noises is also important to prevent further damage and reduce fluctuations. Hearing aids can be adjusted to match your changing hearing levels, and some advanced devices can adapt automatically to hearing changes. Using visual cues, reducing background noise, and informing your communication partners about your hearing fluctuations can make conversations easier and less frustrating. Lifestyle habits like managing stress and maintaining overall health can also help stabilize autoimmune-related hearing issues. Remember, every person's experience with mixed hearing loss is unique, so working closely with healthcare professionals is essential. They can create a personalized plan that might include medical treatment, hearing technology, or even surgical options if needed. Understanding that mixed hearing loss can fluctuate because of the dynamic nature of its causes helps you stay proactive. With proper medical care, assistive devices, and good communication strategies, you can better manage the ups and downs of your hearing. Always consult qualified healthcare providers to find the best approach for your specific situation and keep your hearing health on the right track.